Good day, class. I welcome you to study session 5 of pharmacology, which will discuss the drug derivations and standardization. Here in this study session, we will discuss how drugs are derived, the various sources of drugs. Please sit back and enjoy the lecture. Standardization of drugs means confirmation of its identity and determination of its quality and purity. At present, due to advancements in the chemical knowledge of drugs, various methods like botanical, chemical, spectroscopic, and biological methods are used for estimating the active constituent present in drugs, in addition to its physical constants. In this study session, you will be introduced to the various drug derivatives, the standardization of drug, and the active constituent of plants as a source of drug. At the end of this study session, you should be able to highlight and explain the various sources of drugs. You're able to discuss standardization of drugs and describe the various active constituents of plants as a drug derivative. Derivation of drugs. A derivative is a compound that is derived from a similar compound by some chemical or physical processes. In the past, it was also used to mean a compound that can be imagined to arise from another compound if one atom is replaced with another atom or group of atoms. Drugs can be obtained from 6 major sources. It can be from plants, from animals, from mineral or earth sources, from synthetic and semi-synthetic sources, and we can have from microbiological sources and genetic engineering, which is also the recombinant DNA technology. Many inorganic materials such as metals are chemotherapeutic, hormones, alkaloids, vaccines, and antibiotics come from living organisms, and other drugs are synthetic or semi-synthetic. Synthetics are often more effective and less toxic than the naturally obtained substances and are easier to prepare in standardized units. Looking at plant and animal as a derivative of drug. Plant source is the oldest source of drugs. Most of the drugs in ancient times were derived from plants. Almost all parts of the plant are used. We can use the leaf, the stem, the bark, the fruits, and the roots. Animal sources. The pancreas is a source of insulin that is used in treatment of diabetes that is gotten from animals. Use of pregnant women, urine of pregnant women too can give human chorionic gonadotropin hormone, which is used in treatment for infertility. We can use the sheep thyroid, which is a very good source of thyroxine, and it is used in hypertension. From the picture on your screen, you can see different sources of drugs that are gotten from both animal sources and plant sources. The plant source, we can use the leaf of a plant. You can derive digitalis, which is used to make digoxin and is used in chronic heart failure. The bark, you can get cinchona, which is a drug of quinine, which is used in treating malaria. Fruits can be a form of opium, which is used to make morphine and is used as analgesic. From animal sources, we can have heparin from leech. We can have insulin from pork pancreas. We can have thyroxine from the thyroid. We can have vitamin B12 from liver extract, and so on. Mineral sources as a derivative of drugs. We can have iron that helps in the treatment of anemia, aluminium hydroxide as antacids, iodine used in thyrotoxicosis. We can have magnesium sulfate, which is used as a purgative. We can have sulfur used in scabies. We can have antimony salt used in Kala-Azar, and bismuth salt used in peptic ulcer diseases. Metallic and non-metallic sources like the iron that I've mentioned earlier on can be used in iron deficiency anemia. We can have mercurial salts used in syphilis. We can have zinc, which is used as zinc supplement. Zinc oxide paste is used in wounds and in eczema. Then we have miscellaneous sources like the fluorine that has antiseptic properties, borax that has antiseptic properties as well, selenium as selenium sulfide, which is used in anti-dandruff as shampoos. We have synthetic and semi-synthetic sources of drugs. Synthetic sources: when the nucleus of the drug from natural sources as well as its chemical structure is altered, we call it synthetic. Examples include emethyl bismuth iodine, adrenaline, that is synthesized epinephrine for treating hypersensitivity and asthma attacks. We can have amoxicillin, ampicillin, and piperacillin. The semi-synthetic source: when the nucleus of drug obtained from natural source is retained but the chemical structure is altered, we call it semi-synthetic. We can have penicillins, which is used to treat various infections. We can have apomorphine, diacetylmorphine, ethylene estradiol, omotropine, and so on. Penicillin can also be classified as a microbial source too, which is a fungus that gives penicillin. That is penicillin notatum, which is used to prepare penicillin. And we can have actinobacteria, which gives streptomycin. We can have aminoglycosides such as gentamicin and tobramycin. They are obtained from Streptomyces and Micromonosporas. Standardization of drug. Standardization is defined as the best technical application, conceptual wisdom, inclusive of processes for selection in making appropriate choices for ratification, coupled with consistent decisions for maintaining obtained standards. This view includes the case of spontaneous standardization process to produce de facto standards. Standardization is the formulation of a solution of definite strength so that it may be used for comparison and in test. It is the process of making any drug or other preparation conform to a type of standard. Plant-derived substances have recently become a great interest, owing to their versatile applications. Medicinal plants are the richest bioresource of drugs of traditional systems of medicine, modern medicines, nutraceuticals, food supplements, folk medicines, pharmaceutical intermediates, and chemical entities for synthetic drugs. Extraction methods used pharmaceutically involves the separation of medicinally active portions of plant tissues from the inactive or inert components by using selective solvents. During this extraction, solvents diffuse into the solid plant material and solubilize compounds with similar polarity. Natural drugs obtained from plants and animals are called drugs of biological origin and are produced in the living cells of plants and animals. Pharmacognosy. Pharmacognosy is the study of crude drugs obtained from plants, animals, and mineral kingdom. It means a knowledge or science of drugs. Crude drugs are plants or animals or their parts, which after collection are subjected only to drying or making them into transverse or longitudinal slices of or peeling them in small cases. In most of the crude drugs used in medicine are obtained from plants, and only a small number comes from animal and mineral kingdom. Drugs obtained from plants consist of entire plants or their parts. Like we have mentioned earlier on, we can use the leaf, the stem, the fruit, the bark, the root of plants. Crude drugs may be obtained by simple physical processes like drying or extraction with water. Further drugs used by doctors or pharmacists, directly or indirectly, like cotton, silk, jute, nylon, in surgical dressings or kaolin, diatomites used in filtration of turbid liquids or gums, wax, gelatin, agar used as pharmaceutical auxiliaries or flavoring or sweetening agents or drugs used as vehicles or insecticides are treated in pharmacognosy. Each drug is always obtained from the same plant or animal. The Latin name of plant or animal is called its botanical or the zoological source. What are the active constituents of plants? The active constituents of plants are alkaloid, glycoside, oil, gum, mucilage, carbohydrates, and other related compounds. Some of these active compounds can be extracted by soaking the plant in alcohol. And the purpose of extracting these active constituents is to identify the active constituents, to analyze the pharmacodynamic and pharmacokinetic properties of this active constituent, and to ensure a precise and constant dosage in the therapeutic use of chemically pure constituents. Then to know the possibility of the chemical synthesis. Looking at alkaloid as the active constituent of plants. Alkaloid is defined as the basic nitrogenous compound of plant origin that produces salt when combined with acid and is physiologically active in plants and animals. The properties of alkaloids are they are white crystalline substance, they have bitter taste, they are insoluble in water, but its preparation is highly soluble in water. And almost all alkaloids are soluble in alcohol, ether, chloroform, and oil. The majority of alkaloids are extracted from the flowering plants abundant in seeds and roots. Only a few alkaloids are obtained from the flowerless plant or produced synthetically. Synthetic alkaloids are apomorphine, omatropine, and etc. So there are some sources of alkaloids, and which can be classified alkaloids can be classified according to these sources, like belladonna, cinchona, cocaine, ergot, opium, raffia, vinca, and xanthine. Glycosides as an active constituent of plants. Glycosides are non-nitrogenous colorless crystalline solid that split up into sugar, that is 1 to 4 molecules with non-sugar parts. They do not form salt. Some are poisonous, and the non-sugar part of glycoside is termed the aglycone or genin. The aglycone can be separated from the sugar part of the glycoside. Dextrose is used as an ingredient in many preparations such as dextrose in aqua and dextrose in saline. Dextrose is used as an ingredient of anticoagulants such as dextrose citrate sodium, citrate phosphate dextrose solution, and etc. These solutions are used for the storage of whole blood. And fructose is used for food for diabetic patients and may be of particular benefit in diabetic acidosis. A carbohydrate-related compound, alcohol, is also used as an antiseptic. Thanks for listening. Have a good day.